Just 4 days ago, the Prime Minister had said it would be inhuman to cancel Christmas. But in his latest press conference warning of the rapid spread of a new strain of the virus, in effect, he did just that for London and the southeast of England, putting them into a new Tier 4. Wales will also face the strictest restrictions from midnight tonight, though they will be allowed some mixing on Christmas Day. So here are the measures. In the new Tier 4 for England, there can be no mixing indoors with any other household, even at Christmas. All non-essential shops must close, along with gyms, hairdressers and salons, and no travel will be allowed in or out of the area. In the rest of the country, mixing of up to 3 households will now only be allowed on Christmas Day and not the planned 5-day period. Jane Deith reports.
There was an urgency to the Christmas shopping in London today after a new infectious strain of Covid-19 brought about an extraordinary government response, announced by a Prime Minister who's always said he didn't want to spoil Christmas.
It is with a very heavy heart, I must tell you, we cannot continue with Christmas as planned. In England, those living in Tier 4 areas should not mix with anyone outside their own household at Christmas, though support bubbles will remain in place for those at particular risk of loneliness or isolation. Across the rest of the country, the Christmas rules allowing up to 3 households to meet will now be limited to Christmas Day only, rather than the 5 days as previously set out. So I know how disappointing this will be. But we have said throughout this pandemic that we must and we will be guided by the science. When the science changes, we must change our response. And when the virus changes its method of attack, we must change our method of defence. And as your Prime Minister, I sincerely believe there is no alternative open to me.
The Chief Medical Officer, Chris Whitty, was asked what would he say to people packing a bag to leave the South East before the travel ban comes in at midnight.
My short answer would be, please unpack it at this stage. If they were to go with this new variant unwittingly to an area that has a low prevalence and start this being seeded even more outside the high prevalence areas, that would be a significant risk to the area they went to.
People who find themselves in a whole new tier with no mixing at Christmas were shocked.
Not very happy, and probably won't stick to it. Because they can't tell me what to do with my Christmas and my family's Christmas. So we'll take our own risks.
Well, I'm a teacher in a secondary school and spend all of my day with 1,300 people. So the idea that I now don't have a Christmas and I'm safe to be around everyone else's children but not around my own family is mental.
Basically, I just think it's a necessary evil, to be honest. Unfortunately, things haven't exactly gone to plan with the tier system, whatever, since we come out of the last lockdown.
Well, no one's going to pay any attention to it, are they, to be honest. They're going to still do it, I would think. But we're sticking by it. But, I mean, I think he's a bit too late in his decisions, really, isn't he?
The Labour leader said the Prime Minister should have taken the decision sooner.
I'm really frustrated because I raised this with the Prime Minister on Wednesday and he dismissed that and went on to tell people to have a merry little Christmas, only 3 days later to rip up their plans. And I think the British public's entitled to more decisive leadership than that. They're getting confusion where they need certainty.
The new Covid strain is being investigated by scientists at the government's Porton Down laboratory in Wiltshire to understand what impact the mutations in the virus might have on our immune response and on vaccines.
I think that the vaccines will be effective, but we need to test it. We need to be testing this new strain against multiple sera from vaccinees across multiple trials and different platforms of vaccines to just check that the vaccines are as effective as we hope they are. And I think we must be developing already second-generation vaccines that target not only the spike protein, but other parts of the virus.
In a few hours, millions of people must stay at home to stop the new Covid spreading far and wide. The virus has adapted. The question is, can we adapt to the new rules?
Well, within the last few minutes, Scotland's First Minister Nicola Sturgeon has imposed a strict travel ban between Scotland and the rest of the UK. The whole of Scotland will go into a Tier 4 lockdown for 3 weeks from Boxing Day. And the Wales First Minister, Mark Deith, has given details of the new measures there.
As a Cabinet, we have decided to bring forward to tonight the restrictions that were already planned for immediately after Christmas. And over the Christmas period itself, what would have been 5 days of relaxation are being collapsed simply into 1 day, Christmas Day itself.
Well, there have now been more than 2 million confirmed cases of coronavirus in the UK, underlining the seriousness of the crisis, including another 27,052 new infections in the last 24 hours. 534 deaths have been reported. The official number of people who've now died from Covid-19 stands at 67,075. 350,000 people in the UK have so far received their first dose of the Covid-19 vaccine. Our Health and Social Care editor, Victoria MacDonald, joins me now from the newsroom. Victoria.
Well, this is certainly not the Christmas message the Prime Minister wanted to be delivering. This is a man, after all, who likes to be liked, and a man who had repeatedly promised there would be a Christmas of some sort. But tonight, he was the one who had to stand up there in Downing Street and tell millions of people that their Christmas is cancelled. And let's not forget that only 3 days ago, he was saying, have yourself a merry little Christmas. The emphasis, albeit on the little, but it had perhaps lured many into a false sense that they would be sharing that festive dinner with their loved ones. Well, that is not now going to happen in London, the East and the South East. Tier 4, far stricter than Tier 3. And part of that is because Kent, where this new variant is rampant, has been in Tier 3 already, and it wasn't having any impact. So they now say they need stricter controls.
And what do we know about this new variant, this mutation?
Well, the scientists in the new and emerging respiratory virus threats advisory group, nerve tag, has concluded that this new variant is 70% more transmissible, and this has led to those rates soaring. It was repeatedly emphasised that it doesn't appear to be more harmful or more lethal, and it doesn't appear to be affecting the vaccines. But again, everybody is being vigilant. It needs to be studied in greater detail. This information has now been passed to the World Health Organization. Now, we're told there are 23 mutations, which is an unusually large number of variants. And Public Health England and genomics experts have frantically been studying these. They were first detected back in mid-September, but they now felt they had to release as much information as they know. The Prime Minister and his advisors at Downing Street today were asked, actually, if this was the worst moment of the epidemic. And Professor Chris Whitty, the Chief Medical Officer, said no, because we do have medical countermeasures. He said a vaccine, for instance, which is not what we had in the dark days of March and April, yet his message, as you just heard, was if you are packing your bags to leave the South East, the East and London, then start unpacking.
Thanks, Victoria. Well, joining me now is the former Government Chief Scientific Advisor, Sir Mark Walport, who's a member of the SAGE Advisory Group. Sir Mark, was this inevitable, this change to the Christmas plans?
Well, I mean, the epidemic is changing very rapidly, and therefore I'm afraid it became inevitable. So the increase in the transmissibility meant that the infection rate was going up extremely fast, or is going up extremely fast in the southeast, in London, in the east of England. And more is being learnt about this new variant very, very quickly indeed. And it seems to confer about a 0.4 increase in the reproduction number, which has very significant effects on the rate of growth of the pandemic.
And yet, in terms of the messaging, it was just a few days ago that the Prime Minister was still insisting families could meet at Christmas. Is that problematic?
Well, I mean, the answer is, as the facts, the scientific evidence emerges, so the policy has to respond to it. These are the right policy decisions, and there's still a lot we don't know about this variant, except that we do know that it transmits more easily.
So clearly a lot of work needs to be done pretty quickly on this.
Yeah. Yes, I mean, the good news, in as much as there is any good news, is that it doesn't seem to change the pattern of the disease. And as far as we know, it's probably not going to have a big impact on the effectiveness of the vaccine. So those are very important things. But nevertheless, it is a worry that a new variant has emerged which is more transmissible. But sadly, that is what viruses tend to do. They mutate, they divide fairly frequently, and just a small number of those give the virus that has the mutation a reproductive advantage, and so it transmits more easily.
Are you worried at all about the fact that this change might have come too late? We know that many people may have already started travelling for Christmas.
Well, it is going to be hard to bring it under control, and it's why it was slightly worrying seeing some of the people who were interviewed before who were saying, well, we're not going to do anything about it because, you know, it's not what they do to themselves and their families, but the risk that they pose to the population at large if they do get infected and transmit the infection.
So very briefly, as sad as this is... Sorry, as sad as this is for many families, your message very briefly is?
My message is that there is a more transmissible variant around. It's really important we get the virus under control. There is a vaccine coming, so there is an end in sight.